Hi everyone, my name is Jessica Sharowski. I'm a medical surgical nurse at a busy local hospital. I'm going to be talking to you about an important patient safety concern, that being insulin administration, whether it be sub-Q or IV. I can recall a story about a nursing student in her final semester who was supposed to be administering 1 unit of insulin on the sliding scale and instead drew up 1 milliliter. Luckily for the patient, the instructor was there every step of the way, so the error was recognized and the insulin was never administered. Administering a full milliliter of insulin would be given the patient 100 times the amount ordered, with detrimental side effects that could have even been death. Another example is from a nursing journal when a nurse was attempting to correct hyperkalemia. A physician ordered an injection of IV dextrose to be administered with 4 units of regular insulin intravenously. Rushing, the nurse drew up 4 milliliters of insulin into a 10 ml syringe and administered the dose IV without a second check. The patient became severely hypoglycemic and had to be transferred to the critical care unit for treatment and monitoring. I'm sure you all have your own examples of where you've seen or heard about errors and near misses with insulin. As you can see, mistakes are easy to make and are why it is so important to have proper policies and procedure in place to assure that no errors are made when administering insulin. In the rest of this presentation, we're going to take a look at why this is such a problem and how it can be combated in the hospital setting.
Insulin is considered a high alert medication as it is a drug that bears a heightened risk of causing significant patient harm when used in error. Administering too much insulin carries the risk of severe hypoglycemia, which can manifest as seizures, unconsciousness, and even death. It has been reported that about 1/3 of fatal medical errors are related to insulin therapy. They're more frequent during the administration stage, which is what us nurses deal with on a daily basis. The Joint Commission has released statements that say to establish a check system whereby one nurse prepares the dose and another nurse reviews it, or a nurse double check, and not to store insulin and heparin near each other. The vials can easily get confused during drawing up and administering the dose. Research has shown that double checking insulin preparation has led to decreased administration errors, and that independent double checks can detect up to 95% of errors if done properly. Although it's time consuming, direct observation of medication preparation and administration is considered the gold standard. Therefore, nurses should be making it a priority to require an independent double check during preparation and administration, whether it's sub-Q or making an IV bag outside the pharmacy in an emergency situation. Strategy number 1 to use in the hospital is utilizing a nurse double check. This involves a second nurse checking that it's the correct insulin vial and that the number of units drawn up are correct as well. The double check should follow an appropriate procedure whereby the nurse isn't told what the unit should be and they can figure it out on their own. Second, documenting in the MAR that the insulin has been witnessed. Creating a block that a pop-up so another nurse needs to sign would make sure that the correct dose and drug was drawn up and documented. Just signing off that it was done would be considered fraud. Having this pop up each time it's administered would make sure that nurses are participating in this double check. Here's what it would look like in Power Chart. The yellow box is where the witness would sign. Secondly, they would have to enter their credentials, as in their username and password, so somebody just can't put somebody else's name, that it needs to properly be signed off. Third, insulin and heparin should always be stored separately. Keep them separate off the drug carts when drawing up, so then you're not inadvertently drawing up heparin instead of insulin, or vice versa. In addition, storing U100 concentration insulin in patient care areas rather than higher dose concentrations to avoid any confusion with administering the wrong type of insulin. Thanks for listening. I hope you've learned some tips on how to safely administer insulin to your patients.